I'm joined now by Dr. Vivien Suttorp. Dr. Suttorp is the lead medical officer of health here in the South Zone, and we're going to talk about what lots of people are talking about right now at this time of year, and that's influenza. Our public vaccination campaign begins October 15th. If you're seeing this after that, you can find your local clinics at influenza.ca, and there's a clinic finder there. But in the meantime, Dr. Suttorp is going to tell us about the importance of immunization and a little bit of fun facts about the flu. Welcome.
Thank you very much. So influenza is, we talk about it sort of annually. Around October, we start talking about it. And our flu season typically spans October through end of March. Now, what does that mean? Influenza is a viral illness that impacts our respiratory tract, our lungs. We get runny nose, cough, fever, muscle aches and pains. So it infects our respiratory tract, but it actually impacts our entire bodies. There's some severe complications that can happen from this virus, from influenza viruses, and people can have ear infections, pneumonia, and we also see people die from complications of influenza. Mm-hmm. Influenza is something that comes mainly around in those months of year, and why we get an immunization campaign, we try to be ahead of the wave and the peak of influenza transmission in local areas. So this is a perfect time to think about, early October, think about getting your flu shots, you, yourselves, your families, your loved ones, to protect yourself from the upcoming influenza season.
Let's, if you would be kind enough to explain how when you get a flu vaccine, you are not just protecting yourself.
That's right. So there are many diseases that come around every year. Let's say gastrointestinal infections like diarrhea. There is no vaccine. But for influenza, there is a vaccine. And there are a number of ways we can protect ourselves from transmitting diseases. 1, wash your hands. 2, if you're sick, stay home. 3, if you're sick, don't cook food for other people, because sometimes hand washing isn't necessarily as good as it could be, and you could transmit diseases through cooking food. For influenza, there's a fourth option, and a very good option, which is to get immunized. Influenza is a little bit unique, however, as compared to other vaccine-preventable illnesses. So influenza, the viruses change around the globe most years. There are slight changes in the viruses themselves. And so every year, the vaccine needs to be tweaked and changed a bit. So why we do an annual influenza immunization campaign as opposed to an annual measles campaign. So influenza is one of those viruses that changes. We call it antigenic drift, and we need to update the vaccine annually.
You could think of it as a smart little virus.
It is a smart little virus, and there's many different types of influenza virus, and then there are predictions for the North and Southern Hemisphere as far as which ones most likely will be circulating.
Mm-hmm. Well, I'm thinking of how there's an incubation period, and so if you haven't been vaccinated and you have contracted influenza, but you don't know it yet because you haven't become ill yet, you may be infectious during that incubation period, and that's where you can infect others. Am I right?
Yeah, so if we can talk about the vaccine first. Okay. After immunization, it's about 2 weeks for your body to mount the optimal immune response to a vaccine. So again, getting immunized, the earlier the better, so that your system is primed, if you will, and ready for any circulating influenza virus. You can be exposed to influenza virus in many different locations. Most of the time, it's through sneezing, droplets, people coughing in your face, or even when you're talking to somebody closely. Mm-hmm. It could also sometimes last on doorknobs or on objects, and then you touch your face and your eyes, and it's transmitted that way. Mm-hmm. The incubation period of influenza, so after you've been sneezed on, it can take usually 2 to 4 days or so before you develop symptoms. Prior to developing symptoms, you may be able to share some of the virus already. The initial symptoms may be a bit of runny nose and a sore throat. Well, there's a lot of things that can give us a runny nose, even cold weather, or a sore throat. So often people don't feel that sick yet when they have the very early onset symptoms. People are at work, people go to school, kids go to school. So at that time, when you have a runny nose, you're actually most infectious. and just prior to that. So people are often not meaningfully, but are spreading the wealth of this virus very quickly at the very onset and just prior to actually feeling more sick. And when they say, oh dear, I really don't feel good today, I'm going to stay home.
And so if you're visiting a sick person, a baby, or perhaps a frail elderly person, that's not a good situation.
No, and I think at this time of year, all of us as citizens in Alberta have that obligation to wash our hands. Because if you're washing your hands and having proper cough etiquette, coughing your elbow, wash your hands afterwards, that will prevent a lot of transmission. And obviously also, thirdly, getting your immunization protects you, yourself, your family, and your loved ones as well.
Some people might care and some people might not, but I get asked if I know anything about the vaccine, how many strains it's designed to cover this year. Can you tell us about that?
Yeah, as I said earlier, the vaccine changes slightly every year. And so this year there are 4 different influenza strains captured in the vaccine, if you will. There's sort of proteins that where we mount an immune response to 4 strains, and those are the projected strains that will most likely be circulating.
Based on what's happening in other parts of the globe?
That's right. So it's sort of an ongoing surveillance and tracking across the globe which strains are circulating. For example, what's happening in the southern hemisphere and what will be happening in the northern hemisphere. And most of the time, it's a pretty good match.
Okay.
I think another important point is even the vaccine has 4 different strains in there that most likely will be circulating in Canada and in the northern hemisphere. If you get influenza one week, if you're not immunized, you get influenza, and it may be the old pandemic strain from 2009. And then you could get another strain. So you may be down for a week with illness because you didn't get immunized and you get exposed to influenza. Maybe a month later, you may be exposed to a different strain and you can get sick again. So the proactiveness around hand hygiene, cough etiquette, staying home when you're ill, and immunization is really a package to span across the influenza season, which typically we see sort of that transmission between October and early April.
Okay, I think that's pretty clear, good advice. Is there anything else that you would like to add that people should know?
Yeah, so the vaccine in Alberta is free for all Albertans, 6 months of age and older. And there are a number of different access points where people can obtain vaccines. So many physicians will have it, pharmacists, and within Alberta Health Services. Alberta Health Services will offer vaccine to children under 5, and children over 5 can also be given vaccine in other locations such as pharmacies and physicians.
Okay, thank you very much, Dr. Suttorp.
Thank you.
Get your vaccine and get it early. Be a flu champ and help us fight flu. That's a wrap for another edition of AHS Health Matters. We hope you've enjoyed the segments that we've brought to you, and we hope you'll join us again. If you'd like more information, please visit our website, ahs.ca, and thanks for being with us.